Welcome to the Centeno Schultz Clinic. It might be hard to realize this is a much bigger operation than what you see up on the first floor. In fact, below us is an entire lab complex where we have a sophisticated research lab that allows us to perform primary basic science research using stem cells. Now that lab has all of the types of things that you would see in a research lab that would be in a university that looks at stem cell function. In fact, it's got some things that many of those labs don't possess. In addition to that, we have a state-of-the-art $1 million clean room downstairs where your cells will be processed. And we have all of this stuff here because what's unique about this place is that we were the inventors of orthopedic stem cells in the United States. We've been doing this far longer than anyone else. We originated the concept. So when you go online and see some doctor who is trying to do this, that person learned from someone who learned from someone who learned from someone who learned from us. So what does that state-of-the-art lab allow us to do? For instance, several years ago, we asked the question, could we get a lot more stem cells than anyone else has ever dreamed of getting out of the same bone marrow sample? Meaning, if we take that bone marrow sample and we throw it in an automated bedside centrifuge that every other doctor has, we'll get a certain number of stem cells out of it. We were always able to beat that number with our old same-day stem cell technique, but could we get a lot more? So what do? We put our scientific team to work on that issue, and the answer is yes. We can get an awful lot more stem cells out of that same sample than anyone else on earth can get. In fact, that's such a unique process that we filed a patent on that process because it allows us to pick out a second population of stem cells that live in your bone marrow that everyone else right now just throws away. That procedure allows us to get 10 to 20 times the number of stem cells per unit volume out of your bone marrow when compared to smaller automated bedside centrifuges that are used by most doctors. Regenexx is a different process than most. It's a 3-step procedure. Our own research has shown that that's a more effective procedure than just doing a 1-step procedure where you take stem cells and place them back the same day. Our procedure is a little bit like a farming metaphor. We go ahead and we till the soil with the first injection. We then plant the seeds with the second injection, and the third injection we fertilize. We're the only clinic on earth that's starting to get involved in research that allows us to measure what's in the soil. What that means is that if you were a good farmer, you would go and test the soil to make sure that that soil can grow your seeds really well and give you a good crop yield. In the same way, our goal in testing the soil is to try to find ways that we can improve the conditions inside your knee, inside your hip, your shoulder, etc., to enhance repair. Are there things that you don't have that need to be added? Our state-of-the-art research lab allows us to look at manufacturers' claims. For instance, recently, sales reps started to call us claiming that they had a vial of fetal stem cells or amniotic stem cells that they could sell us. Now, at first we thought this might be great. What a fantastic thing to have these kind of young active stem cells. But we didn't trust the sales reps. In our lab, we were able to look at this to try to see if there was any stem cells, and there were no stem cells in these vials. In fact, there wasn't a living thing. It was all dead tissue. Now, many patients, regrettably, are getting scammed into thinking that they're getting a stem cell injection when in fact, they're getting a dead tissue injection. Now, the doctors really don't know this because they don't have a sophisticated lab to check on this like we do. Again, it's one of the differences between this practice and others around the country. Our focus is not only improving what we do, but also testing the claims of others who might be able to provide us with technology to help you. So everything you're going to get here at Centeno Schultz Clinic has been vetted through that process. Regenexx is the most researched orthopedic stem cell procedure on earth. About a third of the world's literature that's been published and indexed in the US National Library of Medicine from medical journals is on this procedure. What that also means is that we extensively track our patients. We then publish that data, whether it's online so that you can see it. So we're completely transparent about how this works or doesn't work in certain conditions. In addition, we send that information to medical journals and have it peer reviewed. Safety is always a big concern with newer procedures like stem cells. And we've published more safety data on the use of orthopedic stem cells than anyone else in the United States or anyone else in the world. And we've done that because your safety is always our concern here. Now that's quite different than other procedures where there's no safety data published or very, very little. In any new medical technology adoption, there are a couple phases that physicians go through. The first phase is exciting. This is an important thing. This must be able to cure everything. The second phase is it doesn't quite cure everything. It's a good tool. And then the third phase is when you start asking the tough questions. Who doesn't it work for and why? Is there a way to maximize this outcome? How do I stack the deck in a patient's favor so that this will work the vast majority of the time? So at Regenexx, we're well beyond that first phase and second phase and deep into the third phase. At Regenexx, we're well beyond anywhere else because we're asking questions that other physicians haven't even thought of. And why haven't they thought of them? They just haven't been doing this long enough. Often what you'll see in other clinics that are trying to replicate what we've been doing for the last decade or more is a blind injection. What that means is that the doctor has no idea where the needle is going. He has some idea that it might be in the right ballpark, but that's a little bit like using GPS to get you into the right neighborhood, but forgetting that the GPS needs to take you to the right street number. In the same way, it's critical that the doctor use guidance and be experienced in doing that to make sure these cells go to the exact right spot. Now that's not a simple thing that can be learned in a weekend. It's a complex thing that physicians spend a year or two mastering before they get reasonably good at it. In addition to state-of-the-art lab facilities, we also have state-of-the-art injection facilities here. We offer both high-level ultrasound imaging to guide the needle to very specific spots, and we also offer high-level fluoroscopy or real-time X-ray to make sure we're in other spots that require that technology. This is a very unique practice. We see patients from all over the globe. We also treat some of the top athletes. These are NFL players and professional baseball players and others who have entrusted us to do their regenerative medicine care. Why? Because we've been at this a very long time. We're the original clinic in the United States to do this type of work.